Mad for Life, making a difference for a lifetime. Join me, Jill Hicks, as I take us on a quest to learn, to grow, to understand more about ourselves and how we can be the healthiest version and be able to do all the things we want to do for a lifetime. I'll be talking to the scientists, the thinkers, the doctors, the doers, the practitioners, the people that are leading the way in the areas that can improve our health, from our mind health to our body, to our soul, to how we contribute to the world. I'm really excited. This is 20 years in the making for me. Mad for Life, making a difference for a lifetime. I'm so delighted that you're here with us. I'm joined by Dr. Patricia Kaazan, who is a consultant gastroenterologist and a hepatologist, which I'd love you to expand upon that, because that has all the great organs in it, doesn't it? The pancreas, the liver, the gallbladder. Your special interest is in inflammatory bowel disease. That sounds like something that I'd love to hear you talk about at a party. And gastrointestinal ultrasound, clinical nutrition, which I'm fascinated about, bowel cancer surveillance, and disorders of the gut-brain interaction. Fascinating. But for me, I, having had the absolute great fortune of being in your care, for me, you are someone who I feel honoured that I'm on the earth at the same time as you, and that to me you are not just a doctor, but you are the brain of a scientist with the soul of an artist. And that was so prevalent to me when I first met you. And I think that was the connection, that the brain of a scientist, the soul of an artist, and someone that deeply, deeply cares about making a difference to those people who you are treating. You write papers, give presentations throughout the world. You're one of the busiest people I know. So thank you for sharing what is the most precious of all things, and that is your time with us. Hello and welcome.
Hello, and thank you very much for having me today. I really feel humbled and privileged to be sitting here in the same room with you, Jill. Thank you.
Oh, it's beautiful. Now, you're born in Lebanon. You've worked in Japan. You're now in Australia. You've been in Australia for over a decade, so we can claim you as ours.
All yours.
You're ours. You speak English, Arabic, and French. Now, there's something about French that I love, and often, so just a little sort of precursor to this, when if I'm in hot climates, very humid conditions, because my legs are attached to my body with silicone sleeves, as you could imagine, when the weather starts to heat up, the sleeves start to sort of droop and my legs fall off. And often I'm wondering, if I'm on the pavement without my legs on, what do I do? And I've always thought probably best to ask for help in French, because everything sounds better in French. So I've been wondering, are you ever tempted to say to someone, it's time for your colonoscopy, but to say it in French? I mean, what is that in French? What would you say if it's time for your colonoscopy?
C'est le temps de votre colonoscopie. Let's do it.
See, anyone that was anxious about what this means, if for you to just say that in French, that would just change my whole concern about everything. It's just like, this is going to be a beautiful experience, which of course it is. Now, what I really wanted to glean from you today is it's the body within. This great, it's almost like the ocean, isn't it? There's so much mystery and complexity because we don't see it. But someone like you does. And so it's how can you help us understand what is happening inside of our body in those moments where it's screaming to us for some attention. And it's I guess we're all different, so I need to sort of put that as a umbrella over this, that every single person presents with something different. But what are you finding that are those little signs that the body's talking to us and crying out for some attention from something that's going on inside?
Well, look, as you said, we're all different. And it really depends on the condition, on the person, on the disease itself, on the mental health, on the physical health, on the capacity of the patient, on the threshold, the pain threshold, the tolerance threshold. I see a lot of people who don't complain until it's very late.
That's like me.
That's right. Or some people who, come with very minimal symptoms, very worried about those symptoms despite multiple lines of investigations and reassurance. So it depends on a whole lot of things. The patient by itself or by themselves play an important role. Some people seek help, seek advice quite early, and some people have a denial attitude, which is sometimes understandable. They have an issue with accepting, being sick or having a disease, especially young people with chronic disease. Now, I think we live in an endemic of chronic disease.
And we're seeing this age group sort of reducing, aren't we? That we're getting younger people presenting with bowel disease and all sorts of internal organ problems that perhaps we haven't seen before.
No, I think as I said, we live in a pandemic of chronic disease and immune-mediated disease. As an inflammatory bowel disease specialist, we are seeing Crohn's and colitis and bowel cancer more often, more frequently. Australia is one of the leading countries in young onset bowel cancer nowadays. We used to think that Crohn's and colitis are a disease of the Western population, and they used to teach us about genetics, and risk factors. It used to be a European disease exported later to America and Australia, but now it's a global disease. We see in Southeast Asia, in Sub-Saharan Africa, and I do think that the environment, the lifestyle.
I was going to say, why are we seeing this? What do you think it is? What's your sense?
I think it's the globalization, the westernization of diets throughout the globe. For inflammatory bowel disease, the first peak, for example, started after the what you call the industrialization or the industrial revolution, and now we're seeing a second peak in developing countries and I do think it's the food environment. The lifestyle, the pace of our lives nowadays, where, everything is on the go, where women can't really devote more time to the kitchen, or the men don't do farm work anymore. So the way our lives evolved around, industrialization and now digitalization of everything, and perhaps in the future, the artificial intelligence. So we don't need to move as much. Our jobs are more desk jobs. We have a more sedentary lifestyle, but the food environment, the food culture as well, and the way the food are made, we now have more intelligence of how we make more food, or how we have more crops, the output, I'd say the quantity over quality in a lot of the farming industry, the advertisement, for some of the food that we have. So I think we have more sugars in our food, we have more animal fat in our food, we have more highly processed food. Mm-hmm. We did not have this in the olden days.
It's been really interesting exercise, actually. So my daughter is now 12, and since she's been sort of more frequently coming to the supermarket, and I've been showing her the importance of reading the ingredient lists, and I, now we start to research. So what is that? What does that mean? And what is that? And that's not a food. So what is that additive? And what does that additive do? And it's been a really interesting journey to start to break it down to say, actually, what we've just bought is only perhaps 50% of real food. The other 50% is additives. What does those additives do? Then we've started to research cooking utensils and pans, and it's been really quite a quest to look at. Even though I pride myself on eating well, it's been a real quest in understanding what actually is going in. And I can only expect my body to behave in a certain way by what I'm fueling it. But how do we help make those choices? And I think this is the part, isn't it? The disconnect between what you're seeing presented with and how we can be working in a far more preventative lifestyle or preventative habits. Is there, though, and I'm kind of interested in the gut brain, and what are your thoughts on that? Does the body tell us well before the presentation of an illness? Is the body talking to us in ways that perhaps there's a link with our brain, our mind, and the gut brain?
Look, it could be, but we need to learn to listen to our body and to love our body as well. It's really important. And I think there is so many factors that play into this. And first of all, listening and understanding and acknowledging, needs education and needs policies. If all what we're offering for people around us is fast food and, canned food and preservatives, and processed food, etc. This is what they're gonna eat, and I mean we don't give people choices sometimes. And I think as well, cheap food, some of the healthy food and some of the fresh fruits and vegetables and pulses and grain can be more expensive.
Yes.
So I think there is an economic problem in there. In terms of your question about the gut and the brain interaction, they are very well connected. From a scientific perspective, they crosstalk all the time.
I wonder what they're saying. I'd love to know that conversation.
They have a very, very close relationship to each other. Well, sometimes they do. And I can tell you scientifically how it does. But I mean, I always tell a lot of my patients, I see people with what we call a disorder of the gut-brain interaction. And I always tell them, your gut is your second brain. And what do I mean by this? Is there's a couple of things. We have 100 million of neuronal cells around the gut called the enteric nervous system. And it does talk, yes.
100 million?
100 million.
So this is different than biomes and all. So this is 100 million of which cells?
Of nerve cells, of nerves that will talk to the brain all the time, back and forth. We call it a bidirectional relationship. Oh, it's a two-pathway talking.
And are these the indicators that tell us when we're full, or that we're our body is yearning, when we have cravings for things? Is that
one of them? It controls so many things, like there is immune cells that can crosstalk, immune reactions, nerve things when somebody is anxious and they have this sensation, the butterflies in the abdomen. But when you're full, your body we talk a lot about the weight loss medication, the Mujadara and the Ozempic and, the Wegovy, etc. When we are full, our gut talk to our brain, actually, having this sensation of fullness, we release those substance called the GLP-1. And this is
GLP-1.
Yes. Right. And this is where the Mujadara acts. And actually, the GLP that can tell our brain, you're full, stop eating. And those medications now act on the brain in a way by training or retraining the brain to stop eating.
Goodness.
You're full now, stop eating. And that's how some people are getting to lose weight.
So again, everything, our whole engine is our mind.
It is.
Everything starts in the mind. So even the gut brain has to talk to the mind brain to say, we're full, stop.
Stop. That's right.
Goodness me.
So trust your gut when you can.
Trust your gut. Trust your gut. And what about cravings? And does the body does the body tell us that we're deficient in something, and so therefore, have something with more iron or have something that's nutrient rich? Is it? Are we able, do you think, to have that level of relationship where we can, as you beautifully said, when we learn to listen, because the body's always talking? Do you think it's possible for us to?
Look, yes and no. You need to train tame your appetite. You need to train your brain as well. You need to train yourself. But when you're hungry, there is hunger signals, obviously. There is a lot of hormonal, what we call endocrine, paracrine reactions inside your stomach, sends, signals to your brain. You need to eat. What type of nutrients? It really depends. If you're doing an exercise, strenuous exercise, your body might be craving for more, carbs, and some people more protein. There's something, but in the eating biology or it's not as simple, it's complex. Something we call hedonic eating.
Hedonic.
And
I love that.
Do you know what hedon is? He's the Greek god of pleasure.
Yes.
I don't really know what they meant back then in pleasure, but the pleasure in eating. And this is one of the problems we have when people are depressed, when they're anxious, when they're bored,
turn to food.
When they want to socialize, all of this, they turn to food. And this is one of the problems as well, contributing to the obesity pandemic.
But having, being such an international person, do you see differences? So say, living in Japan compared to Lebanon, compared to Europe, compared to Australia, are we doing things differently that perhaps can help us have far more longevity? And I think my whole point is this: I've been living by the motto of to live like my life depends on it. And once I put that lens across anything, I'm able to make such clear choices. And that comes down to food, that comes down to every single thing that I'm, privileged to be alive with. But to have longevity, for me, it's to have health in that longevity, to be able to enjoy life, to be able to participate, to be able to really fully live. So that really is, I think, again, the interest for me of what can we be doing to fully live, to fuel our bodies. And as I said, are you seeing differences in different cultures?
Look, I lived the first 25 years of my life in Lebanon. And although I was born in Beirut, I'm a country girl. So my parents, left the countryside to Beirut city for work, etc. So I used to visit my grandparents every weekend. And we had farms, we had, plants around, we had herbs. It was huge in there. And my grandmom, my mom, they all cooked, amazing, basic countryside, old kitchen food. So this is how I was born.
Brought up.
Yeah, exactly that.
Wow. So your foundations were.
So this is what we call about the Mediterranean diet. It's a very heavy plant-based diet.
Which a lot of doctors say is the exemplar of how we should be eating.
Yeah, something similar, it really needs to be plant-based. And I think, as I said, we did speak about how the expenses and how expensive it can be, but we have a lot of cheap choices as well, healthy, cheap choices that we need to promote, and we need to educate people around. I mean, they're not as some, having some beans, soybeans, broad beans, lentils. We have a dish called moussaka, which has no cheese. It's a Lebanese moussaka, which is eggplants and tomatoes and potatoes and onions and chickpeas. And it's basic, it's homemade, it's all whole food. There's a lot of amazing stuff that we can teach ourselves to eat. So yes, I think the food culture is different between different countries. That's for sure. And as I said, we had farms, we had cherry trees and olive trees around and almond trees. So this is how I was brought up, and this is my cooking now. And I think when I first came to Australia, It was a bit of shock. I didn't have a latte, maybe once every year from Starbucks. And when I came here, I felt like an anomaly when I started my internship at the Queen Elizabeth Hospital. It was a social thing. Let's come and have a latte.
Yes, yeah.
And I didn't know how to drink a latte. It was a hot chocolate for a while for me before I became a double strength latte.
Just black.
That's right. Yeah, this is how it should be,
Yeah.
But so there is a lot of different. You go to the cafeterias to buy food, and sometimes you struggle to find a healthy option. So if you're rushed and you don't have time to prepare your meal, even myself, I work across multiple public and private sites. It's hard to find sometimes a healthy option. So I make sure to try and prepare the night before.
So this is it, isn't it? It's making the time. So if we placed ourselves in a position of the hierarchy of value, and I was reminded of something the other day that I was writing about, which was the greatest relationship we will ever have is the one with ourselves.
Yes.
The person that we should be hold the greatest honor for so in love with is ourselves. Yeah. And so creating that time to say, I need to nourish myself, I need to fuel myself, particularly because we don't know what's happening inside. So I'm always, I guess I'm overcautious because I sadly lost my beautiful mum at a very young age to pancreatic cancer, and it was 12 weeks between diagnosis and her death. And so that's always been a sort of cloud over my life of that concern that when you feel you have so much to live for, it's what can we be doing to make sure that we are overriding a genetic code. And I remember when I first came to see a GP when I came back to Australia, and she was asking me for my history, and I said, well, this is what's happened to Mum, and she said, oh, well, that's it, and so that then also created my beginning of a fascination of are we just having to surrender to our genetic code, or can we override it by the fuel that we put in our bodies and how we look after ourselves?
Yes. Look, we're talking again about longevity, which is a longer time of life, but a good quality. None of us want to live longer with a poor quality of life. Look, scientists suggest that around 25% of our longevity is mandated by genes. But good news.
That's only a quarter.
That's only a quarter.
Yeah.
So there is a lot we can do to improve and, our lifespan, increase our lifespan with a good quality of life.
This is good.
This is good news. So, and diet is one of the most important things we can ever do to our bodies and to our mind. We know for a fact that a bad diet can affect your microbiome, which is the trillions of bacteria sitting in our gut. And that can trigger a lot of disease, from cancers to immune-mediated disease, with obesity and other chronic disease such as diabetes, etc., etc. So having a healthy diet will give you a healthy microbiome and a healthy overall outlook. Again, there is no perfect diet, and every culture has some amazing food, and we can always try to, find a way or find a good diet, because people come and say why Mediterranean diet is such a biased concept. But, there is a lot of amazing African diets, plant-based diets, etc. So the diet is very important. Education about the diet, education about the importance of having whole food, etc.
So should we be doing this as in school? Should this be part of a curriculum, do you think?
In my opinion, we absolutely should. This will, as I said, now we're seeing this high number of early onset bowel cancer in the Australian population, and we do think it's diet related. The processed meat is a big problem, in my opinion, and I mean there's been some studies to suggest that as well. Diet as well can affect depression and anxiety. The microbiome is altered in depression and anxiety. We see that serotonin, which is a very important hormone in our body, is secreted by our gut, our microbiome, our enteric nervous system. Exercising again, will improve your longevity. So there is the healthy living guidelines, where you have to do some aerobic activities, around 150 minutes of moderate activity, do some resistance training. So the muscle health is very important for longevity as well, and having good life choices, not much alcohol, not much smoking.
It's beautiful.
And it's very important to socialize, have a community, have friends, trying to be happy. I know they probably have a full episode about this,
yes.
But, the mental health is very important as well. It was shown in studies that being a positive person can improve your longevity.
Gosh.
Having a positive attitude, a mental mode that's always ready, happy, relaxed.
And to speak in French?
Yes, that's right. That's right.
Because everything sounds beautiful.
Everything is so beautiful, so romantic in French.
That's it.
And going back to food as well, if we can add this, but there's a guy who was a French lawyer in the 18th century, and he used to say, dis-moi ce que tu manges, je te dirai ce que tu es. Dis-moi ce que tu manges, je te dirai ce que tu es. Tell me what you ate, I'll tell you who you are.
Tell me what you ate, and I'll tell you who you are.
That's right.
Oh. I love that.
You love that, or you love the French?
I love both. Merci.
Merci à vous. Mon plaisir absolu.
I hope this conversation has helped you in your commitment to being mad for life, to making a difference for a lifetime. If you'd like to know more, please join us on our website, mad4.life. Until next time, I'm Jill Hicks. Stay mad.